Conflict of interest disclosure for the authors. Peer Health Advocacy Wellness Network, PHAWN for short, commencing a network of peers within First Nations communities in Saskatchewan. My name is Tricia Campbell, and I am the PHAWN coordinator and a part of Wellness Wheel, based out of Regina, Saskatchewan. In a brief overview, peer-to-peer engagement was voiced during community consultations. Communities develop their own peer network based on guidelines and adapt to their cultural values and health priorities. The results expected from the network is peer training and an output of resources and manuals for peers. It is the goal of this network to allow for peers to be well supported to assist physicians and nurses in communities. How can we better support people living with HIV, hepatitis C, and/or using substances? Harmonize Indigenous and Western ways of healing within a peer network. This means integration of harm reduction strategies, access to traditional cultural protocols and practice, and advocacy from people with lived experience embedded into the current models of care. For more information, scanning this QR code will take you to our PHAWN page of the Wellness Wheel website. The peer network originated from an annual team meeting with our partner communities participating in the CIHR grant, enhancing and expanding the Know Your Status initiative in on-reserve Indigenous communities in Saskatchewan. It is within this grant, awarded to the Wellness Wheel team and partner communities, that we have been able to reallocate funds to support this network. Some of our partners already have peers doing work in community, and others are beginning a recruitment process. Each partner community has the opportunity to select their own local peers, peer health advocates, ensuring that these peers are best suited to fulfill the needs and health priorities of their community. Community-specific peer programs address their unique needs, and PHAWN will support each community in remuneration for peers and further development of their program. The Katie Practice Guidelines in Peer Health Navigation for People Living with HIV has been significant in providing general guidelines for peer program development. Peers that have been recruited to the network possess similar lived experiences to individuals who are unable to access care in the current Western healthcare system. Reflective of Know Your Status, we suggested that peers have lived experience with positive HIV or HCV diagnoses or substance use. Ultimately, the determination is given to the community leaders. They will decide who has the most impact on their population. Peers serve as a connection to healthcare for people who may be newly diagnosed, engaged in care, withdrawn, or unable to access care. They help others to navigate the healthcare system, often meeting their clients where they are to facilitate access to services. This is different from care models that will meet clients halfway. For some, halfway is not obtainable. We believe peers have the capacity to become ideal personnel to provide testing and treatment for individuals who otherwise would not access care. Mobile technology and HIPAA-compliant video conferencing apps would become a novel way of bringing physicians and care providers face-to-face with the hardest-to-reach individuals. It was just announced that the film Connecting with Care, Atatacoop, produced by Connor Ashley and Atatacoop Health Center staff, has won the grand prize in the first annual Hepatitis Elimination Video Contest. This film tells the story of Atatacoop, a small Indigenous community located in northern Saskatchewan that has some of the highest hepatitis C and HIV co-infection rates in the country. The film follows the Atatacoop Health Center's Know Your Status program to document key aspects of the community-based Indigenous model of care that has been so successful in treating hepatitis C among the community. PHAWN will develop a toolkit to include practice-based, culturally responsive practices to guide peers. This will be a peer training manual that will include a variety of topics, such as tips for confidentiality, harm reduction training, and trauma-informed care, topics put forth by peer mentors from the Regina Peer-to-Peer program. Development of operational materials to help communities support their peer program are ongoing and can be made at the request of communities. PHAWN will encourage peers to use traditional protocols to support all aspects of wellness and culturally appropriate care. Pan-community training for peers, hosted by PHAWN or linked with other established peer networks across the province, will give peers the opportunity to receive training in HIV and hepatitis C prevention and treatment, education on sexually transmitted infections, self-care training, and substance use basics, such as identifying potential overdose and how to administer naloxone. Peers are valuable as they provide practical assistance. They help in understanding barriers such as transportation, childcare, and food security issues. They help clients with appointment reminders and coordination, and support clients before, during, and after appointments. Peers also assist with access to harm reduction supplies. Peers provide healthcare support when they update the healthcare team about what is happening in the community and by advising healthcare providers on what is culturally appropriate care for clients. Peers provide education by relaying general HIV and hepatitis C knowledge, information about HIV and hepatitis C medication, information on holistic health, and education on harm reduction practices. They are also able to promote health and education events via connections within the community.
Hey, Tanse, my name is Danita Wapusian. My spirit names are Lightning Rock Woman and Calls for Woman. I have been living with HIV since 2005. I first got into the HIV movement a year after my diagnosis. I am from Treaty 4 in Saskatchewan and from Sigamay Anishinaabe First Nation. I am 54 years old. I am a mother of two, a grandmother of 11, and I also work as a peer mentor with the Saskatchewan Health Authority for 7 years, a peer support person at AIDS Program South Saskatchewan. I am also a Willow Warrior at All Nations Hope, and now I am currently the peer consultant with the Peer Health Advocacy Wellness Network.
Okay.
I have been consulted to bring my lived experience as a peer mentor to the Wellness Wheel to help create a peer support network. I believe having a peer support network, we will work together with communities to get HIV testing done, to connect to care, and to help clients remain healthy. I also believe culture interventions will help heal our people. Peer advocacy is non-judgmental. I've modeled my consultations from my peer-to-peer program experiences. Within the peer-to-peer program, our purpose is to provide a unique link for newly diagnosed HIV positive individuals, those who are admitted to hospital, and to others who are living with HIV. The peer support role is supportive. Also within our program, we have program goals. We support those living with HIV to seek health care earlier and more often, to improve and maintain physical, emotional, mental, and spiritual health well-being in a holistic approach. We also to reduce spread of HIV and to reduce stigma and discrimination. Within the peer-to-peer program, the peer mentors are specially trained members of the community who are living with HIV, and we support others who are learning to cope with the daily challenges of living with HIV. We also provide people living with HIV someone to turn to who has been there. Our peer mentor roles are to provide information on Hep C and HIV, to bridge the gap with healthcare providers, to connect to community resources, to help people living with HIV find their way in the healthcare system, to support and encourage harm reduction, to meeting the clients to where they're at, to support overall health and well-being, to share my own experiences about how to live with HIV, to listen to concerns and fears, to model self-care, to maintain client confidentiality, to help people cope with daily struggles in a healthy way, and last, to create a positive space.
To conclude, peers are integral to overall community wellness as they possess knowledge, expertise, the ability to connect with community members, and bring forth cultural responsiveness for care providers. PHAWN's goal is for peers to be well supported to assist prevention, testing, care, and treatment delivery in collaboration with physicians and nurses to deliver a holistic, culturally directed care model. PHAWN would like to explore the utilization of mobile technology to support peers and community workers to enhance linkage to care and treatment outside a standard clinic setting. We would like to acknowledge our peers, health center staff, community leaders, patients, elders, funders, and partners. Thank you. Email fawn@wellnesswheel.ca for more information.